Hello, everyone. I'm Nancy Giles, and some of you might recognize me from CBS News Sunday Morning. I'm also a comedian, a writer, an actress, sometimes political commentator, and a born and bred New Yorker. Although I live in New Jersey now, I've lived in New York most of my life. Millions of New Yorkers have already received the COVID-19 vaccine, and it's beginning to feel like the pandemic is nearing its end. For some, this is a long-awaited return to normalcy. But for millions of others, this catastrophic effect of the economic disaster is going to be experienced for years to come. As a lifelong New Yorker who cares deeply about the health of this city, I am so proud to support Public Health Solutions and their work of improving health equity for the most vulnerable New Yorkers. Public Health Solutions is the largest public health nonprofit serving New Yorkers, and they've been doing this work for more than 60 years. One of the ways in which they support New Yorkers on their path to better health is by providing direct services such as food assistance, health insurance enrollment, maternal and child health support, and reproductive and sexual health services in the most high-need communities. In addition to their direct services, they also serve as an essential link between community-based organizations and healthcare, providing a one-stop shop, if you will, where parents can access a variety of services to meet their needs. This work has become increasingly important over the last year. Underserved communities have been disproportionately impacted by the economic and health consequences of this pandemic. Additionally, a rise in unemployment has created newly vulnerable New Yorkers, unfortunately pushing more parents and families toward poverty. Now, more than ever, it's so important to ensure that people do not experience a gap in receiving their essential services. To learn firsthand about how Public Health Solutions is making a difference in the lives of vulnerable New Yorkers, today we'll be talking with Vanessa Mendez, COVID-19 Program Coordinator at PHS, about their Community Resource Network, which connects New Yorkers in need with wraparound services. Hi, Vanessa. It's so great to have you here with me virtually.
Hi, Nancy. It's good to be here.
So let's start with a little bit about you and the work that you do at Public Health Solutions. Tell us about it.
Sure. So my name is Vanessa Mendez, and I have been with Public Health Solutions since May of 2020 as a COVID-19 coordinator. I'm so sorry for the background noise.
It happens. It's real. We're living in real times with real Zoom interviews. So don't even worry about it.
I help New Yorkers in need get connected to important services that help them achieve and maintain good health. And this is done through our Public Health Solutions Community Resource Network, a platform of health and human service organizations, including us. In addition to that, I help bring in partner organizations to expand our network that best meet the needs of our communities.
Can you tell us about how people get connected to Community Resource Network and also how the platform works?
Absolutely. So the platform is a referral-based system. Clients come to us through outside referrals, including from hospitals, doctors, and community-based organizations. They can also self-referral through our website, www.healthsolutions.org. And we work closely with referred clients to understand their specific needs and help them address both what they came in for originally and services they didn't know they could get connected to.
I think it's really good that people can self-refer, because sometimes doctors or insurance companies won't allow you to get the services you need. So I think that's an important addition that you guys do. Tell me, what kind of services are currently offered?
Yeah, of course. So many clients are surprised that our network covers a wide range of services across our network. And many clients just aren't really sure sometimes of how to get connected.
Sure.
So we have currently 220 organizations in New York City that are actively participating in our network. And we assist people with everything from unemployment to housing, as well as cash assistance and immigration issues. In particular, the food and nutrition services bundle has experienced a high demand over the last year. COVID-19 was devastated for many families, both for their health and financial situations. And putting food on the table has been a daily challenge for many of the New Yorkers. And so through our platform, we help connect food insecure clients with food and nutrition related services. This includes SNAP, WIC, and home delivered meals, as well as linking clients to community resources like food pantries and soup kitchens. And while our community resource network is the main platform, we have specialized networks within the program to ensure that every need is addressed.
That is amazing. And it's funny, it's not funny, but the issue of food insecurity, it hit a lot of people that didn't expect to be hit by that. You know, people that had, for the first time in their lives, needed food pantries and help with just getting food. I'm glad you guys offer that service among everything else. Critical necessities like food and housing, getting those must be like life-changing to people, and such a relief for a lot of your clients. Can you tell us what you've been hearing from the folks that PHS serves?
Definitely. I can actually share a story of one of our clients. Her name is Carmen. Carmen is an elderly client living with diabetes who was referred to us by a social worker from Bellevue Hospital. And during the pandemic, she wasn't physically able to work and her family finances significantly decreased. After Carmen was referred to us, we helped her enroll into SNAP and connected her to Diabetes Self-Management Program, which helps individuals manage their diabetes. And thanks to the program, Carmen now eats healthier and she's lost some weight as well.
Woohoo!
Yeah. And another client who was connected was Karina, a single mother of 3. She originally came from our Public Health Solutions website for WIC services.
Okay.
And in speaking to the support staff from the Jamaica WIC Center, Karina expressed other needs that she needed help with. And so she was referred to the Maternal Child Health Home Visiting Program along with the healthcare program.
See, that's wonderful because it feels like you guys offer such a safe environment for people to honestly talk about like what's going on. And in Carmen's case, by just, discovering that she had diabetes, so many people who got COVID had pre-existing conditions. So you're serving a lot of people's needs and helping in many, many ways. It's fantastic to hear all that you do. When people come to PHS, do they typically come looking for just one kind of service?
Yeah, so often clients come in to see us with one challenge. So they typically will ask for one service. But because we take the time to get to know what our clients really need and they open up, we learn about other ways we can help them. And we regularly connect clients with services that they didn't know existed or were potentially eligible for. And in fact, Carmen was originally referred to us for SNAP enrollment. And when our food navigator started asking follow-up questions, we learned that Carmen was unable to pick up groceries due to her chronic condition. And so from that conversation, we were able to make sure that she received food deliveries from a nonprofit called Invisible Hands Deliver.
Oh my goodness. So, I mean, any kind of like shame or issues around needing food, when you guys got to know your clients or needing whatever they needed, you were able to expand the help that they needed to, and in Carmen's case, actually get the food to her. That is amazing. It sounds like you guys are doing work that really, really makes a difference in people's lives. Vanessa, where do you think PHS clients would go if your network did not exist?
Yeah, so there's no other network in New York City that can comprehensively respond to such a wide range of client needs and partner with external organizations. And despite the pandemic, it's already difficult and challenging for people to track their health. In particular, vulnerable New Yorkers can become discouraged in applying and looking for services. And our platform basically helps lift that burden from the clients and providers. And it prevents many New Yorkers from falling through the cracks. And so one of our clients, Sandra, was previously unsuccessful in applying for SNAP benefits on her own, and she was waiting for a decision. And she was unaware that her case was already closed. And before Sandra can come to PHS, she assumed that there was no other option for her. And thankfully for PHS, Thankfully, a PHS staff member helped Sandra reopen her case and enroll her into medical tailored meals through another partner organization called God's Love We Deliver.
Oh my God, what a relief, because, you know, if one organization can't help you, and in Sandra's case, she didn't even know that the case was closed. You guys were able to come in and find another way. That is great. And PHS really makes incredible progress in helping those very vulnerable New Yorkers. I'm thinking though, as you were saying, even before COVID, there was a need. So I would think now there is still a lot of work to be done. When you're thinking about what's coming next, what do you think PHS will be doing next?
Yeah, so while the pandemic has been slowing down, our work will only become more urgent. And through the strength of the Community Resource Network, it really depends on the number of referrals from our partner organizations. And so we have seen an alarming increase in housing related needs in the last year because of COVID-19. And we are working quickly to connect with and onboard more housing organizations to help. Many New Yorkers still need help finding employment and feeding their families and paying for basic needs. So looking ahead, we make all these things possible, and we hope to do much more.
Oh, that's so great. Thank you so much, Vanessa, for taking the time and talking to us today. It is so insightful to learn about the Community Resource Network and how Public Health Solutions is serving vulnerable New Yorkers now. And Vanessa, thank you for your essential work in this area. We really appreciate it.
You're welcome.
Of course. Now, everyone, as a reminder, you can contribute to Public Health Solutions' ongoing Health Reimagined campaign to help them meet the needs of New Yorkers that staff members like Vanessa work with every day. And as Vanessa just noted, their services are needed now more than ever. Thank you so much for joining us. Everybody, please take care of yourselves and your loved ones and have a really good day.